Why are HPV treatments and screenings so expensive? Have you ever wondered why getting screened for human papillomavirus or HPV and its treatments can be so costly? There are several reasons behind these expenses that are worth exploring. First, let's look at the screening methods. HPV screenings, like Pap smears and HPV DNA tests, requiring advanced laboratory equipment and trained professionals. This specialized technology and expertise drive up the costs. For instance, combining HPV DNA testing with Pap smears every 3 years is generally pricier than just having Pap smears alone. This is due to the advanced techniques involved in the testing process. Next, when it comes to treatment for HPV-related conditions, the costs can increase significantly. Treatments for issues like precancerous cervical lesions or cervical cancer often involve procedures such as cryotherapy or surgical excision. These treatments not only requiring specialized medical skills, but also involve the use of specific equipment and sometimes multiple visits to healthcare providers, all of which add to the overall expense. Another factor influencing costs is the healthcare system itself. In many areas, especially those that are underserved, access to affordable screenings and treatments can be limited. This often leads to higher out-of-pocket expenses for patients due to travel costs, consultation fees, and laboratory charges. For example, in some low-income countries, even basic visual inspection with acetic acid screening can cost several dollars per patient when you factor in transportation and clinical consultations. Insurance and administrative factors also play a significant role in the costs associated with HPV treatments and screenings. While some insurance programs, like Medicare in the United States, cover the costs of HPV screenings, patients may still face premiums, deductibles, or co-pays. For those without insurance or who are underinsured, these services can become prohibitively expensive. Finally, let's not forget the costs associated with research and development. Newer screening technologies and treatments, such as self-sampling HPV tests or molecular triage methods, may improve accuracy and screening rates. However, these innovations often come with higher initial costs until they are widely adopted and scaled. In summary, the expense of HPV treatments and screenings stems from the need for specialized technology and expertise, limitations within the healthcare infrastructure, patient-related costs, variability in insurance coverage, and ongoing research and development. While there are promising efforts to create cost-effective models, such as point-of-care screening and treatment kits, the combination of these factors keeps HPV-related healthcare services relatively expensive. It's always a good idea to consult with healthcare professionals to understand your options and find the best approach for your situation.